Hi, it's Dr. Renee, and welcome back to another episode of Black Doctors Speak podcast. I am so excited. Today, we are talking about something that a lot of people have been talking about for a while, and we're going to talk about one specific part of it because, of course, we're doctors, but we're going to talk about Project 2025. And of course, this is a very important subject to talk about right now because it's a crucial time for us all to understand it, but particularly to understand this really important part of it. I am so excited. My guest today is Dr. Erkeda DeRouen, and let's just jump into it. I'm so excited. Hi, how are you?
Excited to be here. Thank you so much for inviting me. And I'm glad that we're getting some time to talk about this right now because it's such an important time. And for those who may be listening in, I'm sure either you may have a chronic condition or someone that you love that has one, and then everyone will have some kind of touch point with the healthcare system. So it's just very necessary for us to just talk about what kinds of policies are floating out there that could affect everyone's life.
Exactly. I always say health is wealth. So if you do not have your health, you don't have to worry about paying your bills, going to work, going to school, feeding your nothing. You have to have your health. So this is going to affect every single person.
Absolutely.
So let's start. What do you think is the first thing that we need to know about Project 2025 as it relates to healthcare?
One thing I want to just point out, and I know a lot of people have been talking about this with the memes and social media and calling a certain person out, and I'll say his name, Donald Trump, when he talked about his concepts of a plan, when they asked him on the presidential debate with Kamala Harris about what he would do for healthcare. And number one, how can you honestly say that you have concepts of a plane after already being president? But number two, it was not the truth because Project 2025 is out there and it is their plan. So if you guys, I recommend that you go and read it if you have not. It's not that long for the healthcare component. It's about 50 pages, chapter 14, and it lays out everything they plan to do with the healthcare system.
Yeah. So I know the first thing that jumped out at me, I think, was the issue with Medicare. Mm-hmm. And that jumped out at me because I'm a caregiver. And my parents, they do have private insurance because of their previous employers, but they also do rely on Medicare. And so his plan is just to do away with it.
Yeah, it's very concerning. And even if they don't do away with it, there are some things that definitely stand out. Number one, giving more control over to the states in terms of certain parts like Medicaid and different things like that, because we've seen what has happened when we give away healthcare rights, because healthcare is a right. Like we have the right to live healthy lives, well lives. But when we give over that control to states, it can vary. And we shouldn't have different life expectancies in certain areas that other people don't have. Otherwise, they also recommended like increasing drug prices. We've seen how, even with this most recent administration, how life-changing it is to have that ability to negotiate drug prices where people can get insulin for like $35 now. Not so long ago, for those who may have needed insulin in their lives or their loved ones, you have to determine whether or not you'll eat for the week or pay your rent or your mortgage. And now to be able to obtain that for $35, we don't want to take things away that we are making progress on. And then, like you said, being a caregiver, there are so many different things that we can utilize in terms of the Medicare services, in terms of the benefits and able to see your doctors. So to lose that, what kinds of restrictions and what kinds of livelihood do you expect your elders? Most of the people who use Medicare are either elderly or more seasoned and mature, for those who are listening who may be using Medicare right now, or have disabilities. Mm-hmm. So our most vulnerable populations are using this, and you want to take it away from them. That's not okay.
Not at all. And I'm a severe asthmatic. And so the lowering of the inhaler cost was something that blew me away and was so exciting for me, because there was, thankfully I have my own health insurance. And so I've never been one of those people that paid some astronomical figure for an inhaler, but I know people that have had to, and when they started coming down with those prices, I was like, oh my God, this is such a wonderful thing. So, and like you said, insulin, I don't think people realize there's some people that pay like 3-4 figures for insulin before they, this lovely administration was able to get it down. And unfortunately, diabetes is something that we're not doing so good of a job of getting rid of in the United States. And we're coming up with a whole lot of people that are type 2 diabetic. So insulin is something that, probably less than 1 out of 10 people are having to purchase. So that was huge. And just to have the ability to negotiate the prices is a game changer, something that has never happened before and was obviously a real blessing. I know Project 2025 has some thoughts about Obamacare, which it's really not Obamacare. It's affordable health care, the Affordable Health Care Act, which I know for me was a game changer because I was self-employed. And so it was really easy to go to the marketplace and to go and find me, whatever plan that worked for me. And you understand, found a plan that worked for me. And when I first became unemployed, I was it wasn't something I had planned. So I had the government subsidy, which was awesome. So I still got to see the same doctors that I saw before, but the government filled in on what I couldn't afford for the premium. And then as my business grew and then I just took care of the whole thing. But I think that to get rid of that is just a travesty because people, like I said, people like us need it. And it's so much more affordable than Cobra. If anyone has ever had to deal with Cobra, if you go to the healthcare marketplace and you look at those prices and compare them to Cobra, especially if you're a family of like 4, oh my God, Cobra will make you homeless. Seriously.
Absolutely.
Especially if somebody's sick.
And it's coming from a place of privilege to take these things away.
Exactly.
Some of the things that you mentioned earlier, like the medicines that we're excited that they finally got some prices down to negotiate for, are non-negotiable when people need them. You need insulin to live because your body isn't making it and you need it to live. I also have asthma, so you have to choose if you want to breathe or not. So you're probably going to pay for that inhaler.
Right.
So to be able to have affordable medications is one thing. And then also to have affordable access to healthcare, because we know that out of the 40-something industrialized nations in the world, we're the only country who hasn't figured out some form of universal healthcare. And I don't know. I mean, they're doing something right. Nothing's perfect,
nope.
but some kind of mix. And when change comes and when things are new, it's always a little scary. So for those who may be old enough to know about it, like, Medicare always wasn't a guaranteed thing. Like, it's something that came with the New Deal. So like we were able to change, and now it's something where we can't even fathom
not having it.
Right. And now they're talking about taking it away. So with the ACA, it's something that people have been fighting for many administrations to come, and we finally got it. And to see how patients were struggling and choosing between going to the doctor or dying or getting diagnosed really late with scary things like cancer and stuff like that, it's something that's life-changing for people. So to be able to have the ability to afford it is one thing. To think about not having to be turned away or having astronomical prices for pre-existing conditions, which if you live a little life and you're over the age of like 15, you probably have a pre-existing condition like the asthma we just mentioned. And then thinking about all of the other things like the plans that would come and kind of be like predatory on people.
Mm-hmm.
We think about the people who are using this. So yes, people like us who are business owners, and those prices are high, but also those people who are from more low-income families, like you said, a family of 4, which some people have more children than that, and that it could devastate you. So you're making those choices. Or me, who worked in a community health center, people weren't getting care for years. So it's helping those patients who would never be seen, who would never get those mammograms. It's Breast Cancer Awareness Month. And the people who are diagnosed with breast cancer, Black women, we usually have the most severe forms. We die the most from it.
Most aggressive.
Yes, most aggressive. People with colon cancer who aren't getting their colonoscopies. So these protections are protecting us. And they're protecting people not only in urban areas and things that they like to think about, but people who are in more rural areas, people who may not be able to afford these things. So when you're thinking about voting, even if you have health insurance through your job, as we've seen, like health is impacted, like you said, in every aspect of life. So you're just one layoff, as you see in these tech organizations, they're laying everybody off. You see how they're going on these strikes for different things where we were on the verge of not having some goods and services for the holidays. So you're one layoff, one firing, and all of that from being on this side. So you have to think about the protections that are in place for people.
And then I know they're pushing private insurance. Mm-hmm. Not everyone can afford that.
Yes.
And actually, the majority cannot. Mm-hmm. And so when I tell you Project 2025 looks at one demographic of people, it looks at one demographic of people. And really, I always say the number 45 only looks at number 45, but that's just my opinion. But he really is looking out for him and his, and not thinking about, and this is why I think the unions are behind VP Harris, because she is for the working people and he is not. Because the working people, they don't have private insurance. They have insurance through their companies. So I think that it's just insane that he would try to push towards private insurance when most of the country can't afford that. So that's just crazy. The other thing is the reproductive rights. That, first of all, there's a video, I reshared it. There's a gentleman in Iowa, I forgot his name now, but bless his heart. They were talking about you could take a pill and the camera looks at your body. And so he said, well, can't you take the same pill and basically deliver a baby? And we were like, okay, what does swallowing a pill have to do with what comes out of my vagina? I was just like, yes. And so then he tried to say, like, because, obviously it went viral and everyone saw it. And so then people were interviewing him. He's like, I was joking. No, he wasn't. There was a video. We saw your face. And you know what he said? He goes, interesting. I was like,
oh my goodness.
Basic anatomy. Clearly you didn't know, but you're not a doctor. And I'm okay with you not knowing it. But that is why you have no business talking about anybody's health, particularly when it comes to women, when it's usually all men that are up there talking about it. You have no idea, so you shouldn't talk about it. And I just watched a video this morning. John Legend was on Club Shay Shay. You saw it too. And he said, and he was talking about the abortion rights, which, if you know, that's what Dr. DeRouen was talking about when she was saying that we put these healthcare decisions in the states, and it's not wise. That is one of them. The whole Roe v. Wade thing that 45 is so proud of that he did, and putting it on the states. So you go to Georgia and God forbid you have something wrong with your pregnancy and you need to have a DNC, dilatation curettage, you could die because you can't get it done because the doctor doesn't want to go to jail. And I mean, I can't fault the doctor because the doctor probably has a family that they'd like to go home to. And who'd have ever thought that this is the profession we would go into and have to worry about being arrested? Mm-hmm. Like I looked at a lot of professions and I just didn't think this was one of them. But in 2024, you literally could go to jail because you're trying to treat your patient and make sure they don't die. And so that's what we're talking about, where the states have their own thing, because Georgia's one of those states. And then there's several states down south that have Alabama, that have made decisions. And the reproductive rights really blows me away because the fact that somebody could go to another state where they could actually get this performed, but then they could get arrested when they get back home.
There is absolutely no equivalent in men's health where
none.
we are using the government, people without any medical degrees, any medical knowledge, to help advise on what to do with men.
And then they don't have the good sense to ask somebody.
They won't ask. They will make decisions. They will make assumptions. They don't even know how the body works. And we are going back in time. When you just talked about being arrested for providing the care that you were trained to do and that you took an oath to do, one of my mentors in the 60s or 70s who was involved with some of the Roe v. Wade in Boston was arrested for that, Dr. Edelin, and really advocated a lot for these changes. And for us to be decades later still fighting the same fight and still having the same fears. I saw data recently that talked about, since the changes have been enacted in terms of the laws in Texas, that the maternal mortality rate has gone up to 50 something percent. We are not in a third world country. These women
in third world country, women are dying. So
we do not have to die. This is not 1796. Like, we have the knowledge, we have the hospitals, we have the equipment, we have the medications to help women. So women should not be having to take off weeks and go and get all of these different things. They should not be waiting. Like, for those who have not seen the John Legend interview, he was talking about how they are forcing medical people to wait until you're almost dead in order to intervene. So why?
Which is what happened to the young lady in Atlanta.
Yeah, the young lady in Atlanta who went into septic shock and died. She could have been saved, but they waited until she was sick enough. And it's a discrepancy on what is sick enough in order to treat someone. And that is not the way that care should be given. And it's not happening in any other disease except for what's going on in the women's private areas, in their parts, what's going on in their homes. And it's also impacting other things like the medical abortion pill. We call all of these things abortion, but if you've ever had a miscarriage, that is an abortion in the medical part. If you ever had anything that was necessary, one of my best friends recently had a loss and had to spend 2 or 3 weeks trying to find a place to get the pill in a blue state because there's such a shortage. And you have to go through certain processes. So how many more women have to suffer just because people who are not trained in medicine are able to make these decisions? In the Project 2025, not only are they trying to restrict access to abortions, they are trying to have systems where they are surveying, like when you're pregnant and all of those kind of things, and follow you and track you.
Monitoring your cycles, your menstrual cycles. I mean, just ridiculous. Just out of control. And then also, anybody who wants to use IVF, vitro fertilization. Thank you. Intrauterine insemination. Anything that is not regular intercourse, they're trying to put something on that. It's wonderful if two people can come together and make a baby. That's amazing. That's wonderful. It's called the miracle of life, but it's still the miracle of life. IVF, IUI, all of that. I always say that God did not create the scientists to create these things if they weren't meant to be. I say that about medication, because, yes, I'm a pill popper. If something's wrong, I'm going to figure out what pill I need to take, and I'm going to take it. My mother's a priest. I believe in God. I pray as well. I believe in using all the tactics, but I'm also a scientist. So if science says that this is what works, then I'm going to go with that. Yes, I'm going to do other things too, but I'm going to go with that because the science proves that this works. So I think that, we have all sorts of families now in the year of 2024. We have same-sex families, obviously, that neither, couldn't possibly have a baby the regular way. So why can't they, have this opportunity? And I think that that's just, please just don't make the decision for me. That's my whole thing.
Absolutely.
Let me make decisions for myself about my body and my family.
Absolutely. And then also don't change your definitions when it fits and it suits you. So I had so many friends who have experienced IVF, and most people who do want to use alternative methods aren't using it because they want to.
No, it's too important. It's not affordable.
I personally have frozen my eggs. So you shouldn't have to have people living in fear to see like which state did you freeze it and all of those kinds of things. And then also there are some people who are trying to go after embryos. In one case, we're saying that a fetus is a person, but these people's embryos were destroyed in some kind of
Yeah.
accident, and they tried to sue for their, nothing can bring back that, but they said they weren't people. So if you're going to use the same laws, use the same
Use
laws.
the same laws. Yeah. Yeah, and I heard about that too. That's just awful. And so, and I know there's a family that they moved their embryos from one state to another because they felt that something could happen to them, which is just, the whole process is stressful enough being through it. I've been through it myself. For you to have to worry about all this too, that's going to affect your outcome too. So we don't have time for any more extra stress. Like I said, it's not cheap. So it's not like we're doing this because we want to do this, because this just looks like such a wonderful thing to do. No. It's not cheap. And then, it's not guaranteed. So like I said, all this extra stress is just totally not helpful for the whole situation. So not cool at all. Rolling back the anti-discrimination protection in healthcare, that is just,
Yes.
It's hard enough for Black people to go to the hospital and go to the doctor. For you to just throw something else on top of it. We were already having the discussions about implicit biases and all of this, and conscious bias, all of this stuff. We were already having those discussions after COVID, because the numbers were just ridiculous of Black people that were dying of COVID versus white. So we had to, it was like all of a sudden lights went on, and now there's a DEI department at every hospital, because now they're like, oh, I guess there was something going. Come on, it's something that we knew all along. But and once again, in COVID, my father got sick and he had a stroke on March 24th, 2020. And that was in the thick of things. The world shutdown was like a week before that. So the EMS came to the house, picked him up, and my mother was all ready to go. We live in separate states. And I'm on the phone with her. I'm listening. And he was like, oh, you're not coming. And I was like, what? Now, mind you, he had a stroke. The man is completely nonverbal, cannot say a word. And my mother's like, but he can't talk. Like, he can't tell you anything. He's like, well, we'll take these things, because my mother had his records. He's like, we'll take all of this and we'll. So the hospital's around the corner. So they go to the hospital, and my best friend we called her on three-way, because she lives in the same state with them. And she's like, all due respect, Mrs. Matthews, please get in your car and go to the hospital. So my mother goes to the hospital, and she gets through one entrance, but then the next security guard was like, no. And so, but once again, the nurse saw her, ran out, and was like, I think we just got your husband, didn't? And she's like, yeah. And she said, let me get your number. She took her number, and she's like, I'm going to call you myself. I promise I'll call you, but you're right. It looks like a stroke. My mother's a healthcare professional as well. And so she's like, you're right. It looks like it's a stroke and blah, blah, blah. So long story short, it's time for him to go to the rehab, and they let my mom pick him up and take him. They've lost his clothes, shoes, and everything.
That's terrible.
Now, granted, my father is a man. He is, so any man, when you don't, groom regularly, after so many days, you start to look, I hate to say the word, but homeless. You know what I mean? So when we saw him, yes, he looked awful, but he wasn't homeless. He had a family. We literally called 3 times a day, if not more, every day. They were very well aware that I was a physician, and they spoke to me, I think twice the time, 2 times the 2 times a day, because one time is when we would talk to him, and we would call them to get us to talk to him. And the other time I would just call, me and my mom would call, and then my mom would call. So it wasn't like you had no idea he had a family, and you knew why we couldn't visit. It wasn't like there was other people getting visitors. No one could visit. So I was very upset about it. And because I am a doctor and I was able to call on my community, they were able to get me all the way to the top. And we were able to talk to the head of the hospital and, and say how this was just not okay. And the stuff was never found. Oh, and they lost his partial too. Now, the man didn't have on $1 million clothes, but if anyone knows anything about teeth, that's what cost the money. And when he was back to himself, because he had expressive aphasia, once he could communicate clearly with us and everything, he said to us, where are my teeth? There's some on the bottom. he remembered. And he has vascular dementia. So for the fact that he
Mhm.
remembered that made us very happy that he remembered, but we felt so bad, but they lost them in the hospital.
I'm sorry that happened. It's just very frustrating just because when you think about who these protections are
Right.
for the marginalized group. So Black and brown people, LGBT people, people who do not have the means, the voice, or advocates. Everyone isn't blessed to have a doctor in the family.
Exactly.
So yes, we can help, but why should we have to reach out and pull strings and help people? Like, why not treat everyone the
The
same?
same way.
I had a similar negative experience last year where I think going back to the Medicare, Medicaid type thing, my cousin, 30 years old, had been getting worked up for a GYN issue. She has endometriosis for about 2 years. And she had developed a cough. They thought it was COVID. It wasn't. Thought it was pneumonia. It wasn't. Her mom has a history of sarcoid. So they wanted to do a bronchoscopy and see if that was it after months of seeing different people. This is why I strongly implore anyone who is watching this to establish with a primary care. And even women who are in childbearing age seem to love to go to their GYNs. And I love my
Shut up,
GYN
quit talking
friends.
about me.
Yes, I love my GYN friends. You are amazing. But I will say that there is more to you than your vagina and your women parts. So at least once a year, see your primary too.
I have to find one first.
Yes, because when she got the bronchoscopy to check for sarcoid, came back with stage 4 lung cancer.
Oh no.
3 years old. And I live in the DC area. And for those who are familiar with DC, you go 10 minutes in one direction, you're in DC, Maryland, Virginia, either direction. So she was diagnosed in DC at a hospital, but she had Maryland Medicaid. So they told her about her diagnosis and said, because you don't have DC Medicaid, go to the state and get that changed over and come here, or you figure it out. So she called me, being newly diagnosed with stage 4 lung cancer and not knowing what to do. So I went on all the doctor channels and avenues, and I was able within 2 weeks to get her an appointment at Hopkins. And she got one, and the team was wonderful. But just the experience of being in and out, and with all of the stresses and the emphasis that they put on what insurance you have or what access to different resources and things that you have, was terrible. And in one of her experiences, she was admitted to the hospital and they kind of rushed her out, and they made her wait in the hallway for about 4 hours until someone picked her up, as you're admitted with lung cancer. And then the next week, she had a hospital infection. So she didn't want to go to that hospital because they treated her so poorly.
Right.
And then when she got to the new hospital, she was visibly on FaceTime not able to breathe correctly. And I had to call the charge nurse to get her back. And that was the last time I talked to her, because she got to be intubated and she died a few days later. Oh. So we play and we talk about this man who has these concepts of a plan. And I know that there are a lot of Black men, and they may be sensationalizing this on social media, where they're thinking, oh, it wasn't that bad for me, or neither one of the parties is good. There are good things about each, or they helped my finances, they did not. Or they helped this, or I have insurance, I have a job, I don't need this. Think about your family members, think about your friends, think about if it could be you. We're talking about all of this defunding of everything that they are planning to do. It not only can defund these programs that we kind of touched just the base on. We didn't get into everything because we have a limited time, but it also can touch things like funding for people who are training to be doctors, that next generation, where we are already at a physician shortage. So imagine going and getting these diagnoses and people are talking about things being delayed or them not getting care or having 7-month wait for a specialist. That's happening because we don't have enough people who are trained. So think about that as well, because all of this will impact you in one way or another. If you're not a woman, someone you love is. If you are healthy now, 20 or 30 years, you're probably not going to be. You're going to have some kind of ailment because this is just the way of human life across the lifespan. So we have to make decisions and think about how it will impact us throughout our lifespan, as well as those who are coming after us. For those who fought so hard to vote, I told you guys I live in the DC area, and recently I've gone several times, but went with some people again to the African American Museum. And there they have a pin where President Johnson signed the Voting Rights Act. It was in 1964. So within a lifespan, like for some people's parents, some people's grandparents, and so on, we weren't able to vote.
Right.
There are people who are still talking about when they went to vote, they had to pay to vote.
Yes.
You had to do that. So you have the right to get up and vote. You have the right to send it in the mail. You have the right to do something, but don't just think about voting just to increase your pockets or for something to be funny because you want to see some drama on TV as he goes off on whichever world leader he decides to go on this week, like we've seen in the past. But, he told us we would never have to vote again. So there's that.
Thank you. I think people don't seem to understand that. The man said you never have to vote again. It's because he wants to run a dictatorship. I don't know any, especially Black man, that wants to be told what to do. So use your vote and vote, so that you can have a decision because your vote counts. They said that it was like, I forget, the number was so low that it could have turned things around for Hillary Clinton in the state of Michigan. It was so low. I think it was like 3 people per precinct or something. It was something so ridiculously low. So please, everyone go vote and understand that this Project 2025 is not looking out for us. It's just not looking out for us. And if you don't believe me, go read the 900 pages. But healthcare, just looking at healthcare, because there's a whole lot of sections. Just look at healthcare and you can see where it's not looking out for us. I mean, your grandmother and grandfather might be gone, but like she said, you might have children. You might have nieces and nephews, the next generation. All of these people need to be looked out for, and you've got to make sure that they're okay. And the last one I wanted to mention was the restricting of public health programs. These public health programs are very important, particularly in our community, once again, because we tend to need them. Mm-hmm. And so it's really important that we don't let this happen. And, he can preach all he wants about the fact that he knows nothing about this. That's a lie. And, there was a man on TV, on CNN, they went to this county in Georgia that is like so Republican, but they have a few Democrats. So the reporter asked, and so they got these 2 old white men, and they were the ones that were Democrats. And the man said, "Did you see Donald Trump in that debate?" And she said, "Yes." He goes, "Was his lips moving?" He said, "Yeah." He goes, "Then he was lying." Because whenever he moves his lips, he's lying. This man looked like he was like 80 plus. I was like, hallelujah. Okay.
Yes.
And, it was too cute and too funny. And but it's the truth. The man doesn't know the truth. And honestly, he's not in the best health. So can we please try not to take our health advice from him? VP Harris, I'll be very honest with you, the woman looks like the picture of health, because didn't they say she's 60? She turned 60 the other day, right? She looks fabulous. I wish I looked that good at 48. So I wouldn't take my health advice from that one. I'd probably take it from her. But that's just my opinion. But we need to really, really, really think about this. I was watching a bunch of videos this morning. Don Lemon was interviewing and talking to and educating and engaging Black men. And I was really excited because he wasn't yelling at them. He wasn't demeaning them. And he was really explaining things to them. And you could see light bulbs going off. And I've seen a video also today about Project 2025. They had it all printed out. It was really bad. But these Black gentlemen were reading over and were just in a state of complete shock on what they read. And I was like, yes, don't believe the hype. Read it. It's in print. It's in print already. So just read it and figure out, what's right and what's wrong. We've done several of these interviews, and somebody put a stupid comment talking about abortions shouldn't be used as birth control. I 100% agree with that. 100%. But I also do not consider birth control when somebody is past 15 weeks. They want this baby so badly, but something is wrong with the child, or something is the child being in the mother is causing the mother distress, and she might die. Well, at that point, you have to do something. You can't save both. You have to save one or the other.
Absolutely.
So I think that is, and so that, and I don't respond to these comments. These comments don't appear anymore on my thing either. I delete them. So you feel free to say whatever you'd like, but it's not going to be there long because Big Brother is watching, and I'm going to get rid of them, because you can't come to my platform and say such foolishness. And I'm not going to argue with you. My job is not to convince anyone. My job is just to educate you. I just want you to have the information. If it is okay for someone to come into your doctor's office, basically your appointment, into the exam room while you've got your legs spread eagle, because this is some of our white female friends who are okay with this, right? You got your legs spread eagle and you're okay with some government official coming in and saying, stop, don't do that. Then please vote the way that you'd like. But I think most women that I know personally wouldn't want the government in between their legs.
I agree. Like these people who say that they're not into politics, politics is into you. So regardless of what you believe in, what you want it to be about, like use your voice, because this is the time for them to listen. And like you mentioned earlier, how you definitely wouldn't take advice from Trump, but Harris, she released her statements. But even with that, when you think about it, when he was saying that Project 2025, he has no idea. All of the people who were in his administration and his advisors are doing it. Like Ben Carson was a part of this right up on
God bless him. God bless him.
So how can everyone mysteriously like leave you out the meeting, but they're creating this book for the next phase? So there's that. But then when you also think about it, I think with Robert Kennedy Jr., he's fighting bears and stuff, and he said he wants to be over the Department of HHS. So think about the leaders that your leader would put in place and who will put people who are subject matter experts, because we don't want politicians in our offices. We want policies that are coming forth by advisors who have experience, who have been trained, who use evidence-based medicine and not just fear-mongering and theories and conspiracy ones at that, to help us make decisions that will help move us forward, help increase our life expectancies. During the pandemic, the American life expectancies have decreased and we're going up, but we don't want to set ourselves back. So we have to figure out ways in which we can use our voice and advocate for those changes that are needed. And everything won't happen at once. That's why you have to not only vote for the president, you have to vote for your governors, you have to vote for your senators. We can have all of this excitement. We have to vote for our county executives and all of that kind of stuff too, our mayor.
Board, all of that.
Everything. But we can have all of these ideas, but we also don't want to end up in a place where we have this plan and someone with concepts of a plan, but we have this plan and we're stuck in Congress because they're fighting. So we have to knock that out so that we can move forward and we can see a change over this next decade, as opposed to just sitting back and watching what's going to happen to us next. We have to be the voice to help push things forward and get active.
Thank you so much. And you are absolutely 100% right. She is spot on. And also, I want to mention that recently they had to turn over their health records, and VP Harris turned over hers, and 45 has yet to respond. So that tells you something else. But yeah, it's really important. We want to go forward. We do not want to go back. I was so grateful that I was born when I was born, because I don't think I'd have survived. Like, I think Harriet would have left me, because she'd have been like, okay, this girl's too much. And she'd have just left me, and I probably would have been okay with it and not have said, Lord, take me now. But that's why the Lord didn't have me born then. So therefore, we don't need to go back. We need to move forward. And we need to make certain that the people in the White House will help the president move forward. As the vice president, VP Harris could only do what Biden asked her to do. Thank you, Uncle Joe, because you did a good job. And I know that before you leave, you're going to make sure my student loans are eliminated. I know you will. Hallelujah. But VP Harris, as president, has wonderful plans, especially when it comes to health, especially Medicare and caregiving. I'm very excited about that because I know my dad's a vet, and so we got a lot of things because he's a vet that have helped us with him. But for those that are not vets, this plan is really going to be very helpful to those people. So I really hope that everyone will pay attention. And if you don't trust us, go read Project 2025. You can just Google and say Project 2025 PDF, and you can get the whole thing yourself, the whole 900 pages. But please do your due diligence. Please don't forget to vote. Vote early if at all possible, because you just don't want anything to go wrong. I've had people mail in their ballots and then they got a notification saying that something wasn't signed. Well, thank God they mailed it in already, because they've already gotten this information back. Because if you wait till November 5th, you won't have that opportunity to fix it. So please, if you can mail it in, mail it in. If you are able-bodied, try and take some people with you to the polls. You know, we have a lot of new voters that are new college students in out of state. Call them up, text them, email them something. Please, 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 let's get out and vote. And let's make a huge difference. This is going to be an amazing, amazing year. This election is really, it's been a lot, but we have the opportunity to once again set a record and break history and have a Black woman as president. Like, what? I mean, honestly, when I was a child, I think I thought you had to be a white man to be president. I really think I thought that.
Because that's all that there ever was.
That's all there ever was. And then there was Obama. And actually, I will tell you, when Jesse Jackson ran, I couldn't vote, obviously. I was in elementary school, but I remember wanting to vote for him and being so excited and then so upset when he didn't make it on the ticket. But, I was one of those people, though. I don't do politics, but then politics stepped into my arena of healthcare. And so I had to speak out in COVID. And so now I have to, because healthcare is such a huge part of this campaign and this ticket, I have to make sure I do my due diligence, because granted, I don't practice medicine and treating patients daily, but I have enough colleagues that do, that I do not want them to be worried about going to jail because they're doing their job, or worried about, feeding their families because they have to quit their jobs because they just can't do them effectively anymore, or losing patients that they don't need to lose. So everyone, please read Project 2025, or you can Google and watch videos on YouTube, TikTok, Instagram, everywhere about Project 2025 to make sure that you understand exactly what they are looking to do, and get out and vote. So
I couldn't have said it better myself. Like, we love to talk, and for those who may be a little more in tune with healthcare, we love to talk about the social determinants of health. And yes, that's kind of like the common sense determinants. If you have more money, safe neighborhoods, better education, access to healthcare, and those things, you're going to be healthier. But what we don't talk enough about is that those are influenced by the political determinants of health. Who you vote for makes the decision for your county, for your zip code, on what grocery stores will be there for you to be healthier, what hospitals are getting shut down. I didn't talk about that and we don't have time, but one of my friends coded twice, which means she died during childbirth because she had preeclampsia. They were paging the wrong doctor, and she was in a crowded hospital in Atlanta. She is a physician, passed out and stuff. And it was because her other hospital shut down. And we have to make these pushes to keep things in our community for us. So we have to fight in order to have an opportunity to make impact and to live the lives that we want to live. So it starts at home, it starts in your community, and it builds out. So that comes with your political power. and using your voice to make those changes so that your kids can walk around your neighborhood. We talk about like the obesity epidemic. You want to be able to go and exercise. You want to be able to go and get a job, have scholarships, have all of this funding and stuff there in your communities that is enriching you guys. So use your voice. It's powering your voice. I know you guys are probably tired of these podcasts, tired of these webinars, and we've been talking about this for months, and even more so since VP Harris came forward as the candidate. But there were great things that were done, many great things by Biden. Like we women were not allowed to even be a part of research until the 1990s. So all of these things that are happening in medicine are from studies on men. So now that we've got more funding in that, that's amazing. We want to be moving forward, like I keep saying, and not backwards. So we're not going back. So go straight to those polls and you will never have to listen to us again, beg you to vote. So not only you go vote, share this video with people. Go and let people know the key points that you learned about this. Even if you're sick of talking about it, make sure they vote too. You know, you can like spy on people and see if they vote. You don't have to see who they voted for, but you can see if they voted. So don't let them lie to you. So do those pushes. Call your nephews, call your little cousins, call your aunties, like give them a ride, do some kind of carpooling or something and go vote.
Definitely. Thank you so much for your time. And this has been Black Doctors Speak podcast. You can watch us on YouTube, but you can also catch us on all the podcast platforms. Thank you so much. And please visit us. We are sponsored by the African American Wellness Project. And you can visit our website at aawellness.org for more information. Thank you so much. Have a great day.